Good morning and welcome back. Today we have Dr. Ortega joining us from Atrium. Thank you for being here today.
Yeah, good morning. How are you?
I'm good and I'm excited. We have a really good topic today. We're talking about an important subject, which is
Pap smears and screening.
Okay, and so let's talk about it. What does that entail for people who maybe don't get them? What do we need to know about it?
Yeah, I mean, so once you turn age 21, it's kind of when we start having pap smears. And when you're younger than 30, we typically do the pap smear every 3 years if they're normal. If they're not normal, you gotta kind of, depending on what it shows, have close follow-up with your OBGYN, but every 3 years until you're 30, and then once you hit 30, we start screening for HPV. And some providers can screen every 3 years without the HPV if they want, but HPV is really important, largely because it's the virus that we know causes cervical cancer. So vaccines are also important to prevent getting and acquiring it, but also the screening will help us catch it early.
Wow, and so why is it so key that women are regularly getting these screenings? What happens? I mean, sometimes life gets busy. We skip it, you know, but why is it so important that we do this and we don't miss these checkups?
I mean, when we do your exams, you know, we kind of also check other parts of the, pelvic area to ensure that there's nothing, any moles that are kind of showing up that you may not check yourself. I mean, you never know what we might find. We check the vulva, we check every kind of part to ensure that there's nothing popping up that maybe you wouldn't have recognized yourself. So those pelvic exams are important, not just for the pap smears, but also just for a thorough examination and finding anything abnormal.
All right, so the new recommendation is every 3 years. I want to ask, what was it before and why is it important that we do that 3 years? Can we go earlier? What do we need to know as women?
I mean, every 3 years for now. I mean, before I think people used to do them like every year, every annually, everything like that. And sometimes it depends on your insurance too, but every 3 years, it kind of helps to see if there's any abnormal cellular change on the actual cervix itself. And any earlier than that, we found that interventions were being done that weren't maybe necessarily appropriate. So that's why the guidance have kind of spaced out a little bit. And then we added the HPV screening because that we know, again, HPV causes cervical cancer. So adding that once you're turned age 30, before age 30, your body kind of clears it on its own. But once you kind of hit my age,
things change once you get older and wiser.
Things change a little bit, so you gotta kind of have to go and get that screening done. Yeah, and now they kind of offer screening with HPV alone. For that same reason, HPV we know causes cervical cancer, so you can kind of also offer that's kind of like where I think the trend is heading is HPV screening alone, instead of having the full pap smear done with it.
All right, and so I think the big question is why. I think a lot of times as women, sometimes, like I had said, we are just so busy in the midst of it all. Why is it so important that we pause and get these screenings done? What do you want to tell women that maybe just keep putting it off? Why is it so important that we get these screenings?
Because we can catch it early, right? In my personal opinion, if we live in the United States of America, there's no reason someone should have cervical cancer. That screening helps us catch it early, and we can do interventions. We can prevent it from, going further, catching any abnormal cellular change, and offering you treatment. I think is the best way to put it.
Okay, so I know the new recommendation is every 3 years to go for that pap smear, but why is it important that we still continue to go every year to get checkups?
Yeah, I mean, I think it's important, again, to touch base with your OBGYN to really see if there's anything that you need as a female, whether it's contraception, whether it's planning your next pregnancy, whether it's if you have like early menopause symptoms, things like that. That's the time for us to kind of check in and see what issues you're having and really kind of intervene early. Bowel incontinence, bladder incontinence, that's often something that us females struggle with, and we may not be open with other providers like a primary care doctor, but with an OBGYN, maybe you feel a little bit more comfortable because it's a little bit more of a personal exam. So sometimes that conversation is easier to come up in the actual exam room.
All right, and so just because it's every 3 years for your pap smear, still continue to go every year. That's important to know.
Yeah, for sure.